Okay, so now we are going to talk a bit here about plantar fasciitis, and this is brought to you by Progressive Physiotherapy and the Cardiac Fitness Clinic. So let's go. Right, so what exactly is plantar fasciitis? So plantar fasciitis really is loosely defined as the inflammation of the plantar fascia. So of course you're asking what exactly is the plantar fascia. So the plantar fascia really is this thick ligament here that starts at the heel and it runs under the foot and then connects to the toe bones. And this is a tough ligament that is there for arch support of the foot, which is responsible for shock absorption. The reason you have an arch in the foot is for shock absorption. So what are the symptoms and signs of plantar fasciitis? So a lot of people report that, for example, getting out of bed in the morning, that they experience this sharp pain in the heels as they put the foot on the floor. And the pain itself, it will tend to reduce as they keep walking for a bit. And the reason for this is as you get up, the plantar fascia, it's a bit shortened while you sleep. And then as you step on the floor, you're actually trying to stretch this, violently stretch this shortened tissue. And this is what gives you the pain. As you walk, the tissue moves from a shortened state to a slightly longer state. And that is why the pain tends to ease up as the plantar fascia is a bit longer now. Now you have less strain on the attachment point at the heel. Also, throughout the day, a person, while they're sitting for a while, and then as they get up to walk, that's when again they feel that sharp pain in the heel that can subside when the person is, as you begin to walk. As well as if you have a chronic plantar fasciitis, it would tend to actually show a heel spur. And now the heel spur, as you see it on the x-ray here, a heel spur really, it is this calcium deposit that is deposited in the plantar fascia, which attaches to the heel. The plantar fascia, as it becomes chronically inflamed, what you have is calcium deposits being in the plantar fascia itself, and that's why you see the heel spur on the x-ray. Now the heel spur itself is not the actual cause of the pain. The actual cause of the pain is plantar fasciitis, and when plantar fasciitis is actually chronic, you get the heel spur in the plantar fascia, which then shows up on the x-ray. So who gets plantar fasciitis? Well, you got long distance runners, because if you are constantly running, you're constantly going to keep stretching and straining that plantar fascia. So that's one reason why runners would get plantar fasciitis. Also, if you're overweight, what you tend to have is you're asking the plantar fascia to actually support more weight. So the risk of plantar fasciitis developing is greater. Also, shoes without proper support. Now, when I say proper support, I'm not necessarily speaking about shoes that are soft, but rather if you don't have a proper arch support in the shoe, what tends to happen is that you overwork the plantar fascia, and this is also a risk factor for plantar fasciitis. So shoes without proper support in the insoles can put you at higher risk for plantar fasciitis as you go about your daily activities. Now, here we have some examples of some insoles with proper arch support. As you can see here, let's go back there. All right. Okay, as you can see here, there's a proper arch support here. Now, a word about arch support. Now, sometimes when you buy insoles, what you tend to have is in the package, you would see that there is an arch in the insoles, and you may tend to think that this is adequate, that this arch is adequate, and not necessarily so. A lot of times the insoles that you purchase, when you press on the arch of the insole, it basically can deform pretty easily with only a couple pounds of pressure. So as you can imagine, if the arch of an insole, it is compressed very easily, it is unlikely to give you adequate arch support as you step on the insole. Now, this brand of insoles here, Power Step, it has proper arch support, and it's fairly firm, and it can give you adequate arch support. So depending on the brand of insoles that you are using, that is when you can get proper arch support. Not all insoles that have proper arch support, have a proper arch in the shape, means it's actually going to give you proper arch support. Okay, so what are the causes of plantar fasciitis? Now, first of all, the plantar fascia, that ligament that runs from the heel to the toes, it's there to absorb shock. It's there to support the arch of the foot. And when the arch of and the reason again you have an arch is to absorb shock. So now if you are engaged in activity which there is repetitive stressing and straining of the plantar fascia, and then there are repetitive tears, this can lead to inflammation. And that is the general mechanism of plantar fasciitis. That is the plantar fascia constantly being stretched and strained, and then it will actually tear. You get some micro tears within the plantar fascia, which then leads to inflammation, and the inflammation is what causes the pain of plantar fasciitis, especially on the attachment point of the heel of the foot. So what are the risk factors for plantar fasciitis? Well, those between the ages of 40 to 60, they tend to, that's the age group where you tend to get plantar fasciitis generally developing. Also, if you are a long-distance runner or engage in long-distance running, this also is a risk factor for plantar fasciitis. And this is because there is repetitive, again, stressing and straining of the plantar fascia as you are running. Also, activities like aerobic dance or what you would call Zumba. This is also a risk factor for plantar fasciitis. With you always landing on the foot all the time, you are constantly stressing and straining that plantar fascia. This makes you at risk for developing plantar fasciitis. Also, flat feet, high arches, and abnormal walking. Now, if you have flat feet, it is chances are your plantar fascia has been very stretched out, and the shock absorbing capability of the foot is reduced. So with flat feet, that is the mechanism by which you are at risk for developing plantar fasciitis. With high arches, if you genetically have high arches, if that's the natural shape of your foot, it is likely that genetically your plantar fascia is not as flexible as others, and so it may not absorb shock as well as people with normal arches. Of course, the trade-off is that if you have high arches, it makes you a better sprinter. But again, the trade-off is that it puts you at risk for plantar fasciitis. An abnormal walking pattern. Now, let's say you develop a foot injury. You were in a car accident, you fractured your leg or you fractured your foot, and now it heals. But now you develop an abnormal walking pattern. The abnormal walking pattern may actually cause you to distribute weight improperly under the foot, and then thereby stressing out the plantar fascia more so than usual. So again, so an abnormal walking pattern by, let's say you were born again with maybe a particular defect, a leg length discrepancy, certain abnormality of the foot, being involved in an accident. This can put you at risk for plantar fasciitis more so than the average person. Obesity. Again, if you are overweight, you are asking the plantar fascia to bear more weight than usual. And this is a risk factor for developing plantar fasciitis. Being on your feet a lot, for example, a police officer, a teacher, can also put you at risk for plantar fasciitis because you're asking the plantar fascia to do more work, and this is a risk factor for plantar fasciitis. Working on hard surfaces, for example, if you are a construction worker and you are in proper footwear and you are also working on hard surfaces, the hard surface means that the plantar fascia, as well as the shock absorbing mechanism of the foot, has more work to do because of the hard surface. Okay, and this puts you at risk for plantar fasciitis. What about the complications of plantar fasciitis? Now, let's say you develop an abnormal walking pattern because, let's say, one foot has severe plantar fasciitis, and now you're trying to compensate by putting more weight on the other foot. Over time, if you keep doing this, an imbalance is definitely going to develop. And what is going to happen is that you may find yourself developing back pain, hip pain, and knee pains as a result of you trying to compensate for the ongoing plantar fasciitis. Okay, so what about diagnosing plantar fasciitis? It is very rare that you are going to need a scan. That's rare. Generally, the doctor's interview, where you tell the doctor the pattern of the pain. For example, you say, hey doc, when I get up in the morning and I put my foot on the floor, my heel hurts. I have to tiptoe or limp for a while, and then the pain subsides. And then the doctor does an examination, asks you, he feels the calf muscle, if the calf muscle feel a bit tight or stiff, if there's reduced calf flexibility upon the physical examination, if the arch of the foot is painful when the doctor is pressing into the arch of the foot. This combined with the history of the pain or the pattern of the pain that you are describing can give a fairly accurate diagnosis of plantar fasciitis. Now, again, I said imaging tests are generally unnecessary, but let's say the pattern of pain you're describing is not typical of plantar fasciitis. If the physical exam gives results that are not typical of plantar fasciitis, and the doctor suspects maybe you have a stress fracture or pinch nerve, in this case, this is where x-rays or MRIs may actually become necessary to hone in on the actual diagnosis. Okay, now what about treating plantar fasciitis? So generally you would think about the conservative or the non-surgical, and then on the other end you have the surgical treatment. Always advisable to go conservative or non-surgical first. So in treating plantar fasciitis, what we're looking at here is massage therapy, very useful. Not just massage therapy under the foot, but also the calf muscles. A lot of people ignore the calf muscles in dealing with plantar fasciitis. And the reason the calf muscle must be dealt with is that if you have tight calves, then it doesn't allow a proper the ankle to flex properly. Okay, and this would result in an inefficient walking pattern or an abnormal walking pattern, which can trigger plantar fasciitis or it can exacerbate existing plantar fasciitis. Okay, so not just under the foot we're dealing with here, but you got to deal with the calf. You got to go a bit further up the chain, and also at times you may have to deal with maybe scoliosis or hip misalignment as well. Okay, fascia release. So there are certain deep tissue methods or other techniques that can be used with additional massage tools, which can release the plantar, which can do fascia release under the foot. With the repetitive stress and strain, what may happen is that with the plantar fascia, some scar tissue may develop and attach the plantar fascia to the underlying skin or overlying skin, and this causes the plantar fascia to not move or glide properly. So by doing certain release techniques with massage tools, for example, maybe Graston technique or gua sha or fascia release, just about all of them are basically related. They are similar, and by doing that release, here, what you can do, you can actually break away some of the scar tissue that attaches the plantar fascia to the overlying skin. So, and this can help with the treatment of plantar fasciitis. With the personal experience at the clinic, I found that when we are incorporating the fascia release, the results tend to be better overall since we started to apply this method. Physical therapy, for example, exercises and stretching for the calves as well as the plantar fascia under the foot are very useful. Physical therapists may also use TENS treatment, which is a form of electrical stimulation, as well as therapeutic ultrasound can be used by a physiotherapist or massage therapist to help with the plantar fasciitis. Now, certain additional tools can be used, for example, plantar fasciitis strap, night splints, or orthotics. Orthotics are just basically a fancy word for insoles. So let's talk about the plantar fasciitis strap. Now, in a similar manner, if you get a back injury, you may need to wear a back belt to support the back muscles as well as the ligaments of the back in order for you to heal properly. That is the same principle here with the plantar fasciitis strap. It is a belt for the plantar fascia, and it is supporting the plantar fascia, giving it a chance to heal in those who have plantar fasciitis. Then there is the night splint. Okay. Now, normally at night when you're sleeping, your foot will hang forward like this. Okay, and what you may have is maybe some shortening of the calf muscle as you're sleeping because of the foot in this position. But if you wear a night splint, I say wear it at night, it's going to take the foot from this position to more this position here. And what you get is you sleep and you allow the calf muscle to stretch, as well as you can allow the plantar fascia to stretch at night while you're sleeping. So when you get up in the morning and you put your foot on the floor, you're not loading up a tightened plantar fascia as you normally would. Because of the splint, awake with a slightly lengthened plantar fascia. So when you put your foot on the floor, the pain may not be severe as before, or it may not be there at all. Normally, you'd have to wear a night splint, maybe 3 to 5 nights, depending on the severity, for you to really get the relief from plantar fasciitis. Always advisable to use this in conjunction with your therapies. Again, I said orthotics, so basically a fancy word for shoe insoles. Again, to proper insoles with proper arch support is key in treating plantar fasciitis. Okay, also we're looking at anti-inflammatories on home exercises. Anti-inflammatories may be needed by those who maybe have some severe plantar fasciitis, and in conjunction with the therapies may use some anti-inflammatory medication to help with pain control. Okay, and then there are also the home exercises. Now, home exercises, for example, can be recommended by a therapist or a physiotherapist or massage therapist. For example, rolling your foot on a golf ball at home can help to release the plantar fascia tissue. The golf ball, basically, these exercises are basically to continue on with what was done in the clinic. It's not a matter of you coming to the clinic, getting treated, and you're going home and you're not doing anything. There's always homework to do whenever you try to treat plantar fasciitis, and part of your homework will be to roll your foot on a golf ball or even a tennis ball to help to continue to keep that plantar fascia loose. Also, the calf muscles. Once again, we're not ignoring the calf muscles. We generally will have to attend to them. And a muscle roller or foam roller, as you see here, can be used at home to roll and massage the calf muscles, making them a bit looser, giving them more flexibility, giving the ankle greater mobility. If you don't have a muscle roller, you can use a tennis ball or a cricket ball and put it under the one calf muscle at a time, and you do that backward and forward sort of a roll. That will help to loosen and keep those calf muscles flexible. Also, calf stretching. This position that you're seeing here allows you to stretch the calf muscles and keep them flexible. Very simple stuff. Also, there are foam wedges that can be purchased online, which can help you to stretch your calf muscles if maybe holding this position is a bit difficult for you for whatever reason. Maybe some of the foam wedges here can help you to stretch your calf muscles more effectively. Okay, now we're coming to steroid injections. A lot of people ask us about if we offer steroid injections. At our clinic we don't, but if you want, we can refer you outside to do that. Now, for steroid injections, with steroid injections, you need to understand that it is not solving the problem. It may offer temporary pain relief. Okay, if you have severe plantar fasciitis and it is affecting your quality of life, if it is keeping you from working and earning a living, then by all means, it's a personal choice. You go ahead and you can get it. But know that there is the risk of possible rupture of the plantar fascia if you use steroid injections. If steroid injections are done more than 4 times a year, your risk of diabetes goes up. It may make you pre-diabetic. It may worsen your existing diabetes. So you have to really temper the use of the steroid injections. Now, because the steroid injection does not actually deal with the problem, it's really more symptom control. If the pain does return, it can return worse than before. And this is because if you get the steroid injection and you get that reduction in pain, you may be tempted to go back to your original activity and not actually deal with the problem. So when the steroid injection wears off, what tends to happen is that the pain returns worse than before. Okay, so you have to be aware of that. If you do get a steroid injection, it is highly recommended you still do the therapy, get the pain relief, but do the therapy, deal with the problem. That's our advice. When it comes to surgery, okay, now the surgical method here is where you actually detach the plantar fascia from the heel bone. Okay, so there's no attachment. When that is done, the plantar fascia is no longer attached to the heel bone, and so the pain just generally tend to go away. But know that remember the plantar fascia was there to support the arch of the foot. So when you cut the plantar fascia, what tends to happen is that you weaken the arch of the foot. Okay, so just be aware of that. Right? Lifestyle. Okay, yeah, sorry. Okay, sorry about that. We had a bit of a break in the connection there. Okay, so what tends to happen is, okay, so let's say your shoes are either cutting on the inside or the outside. Okay, and you decide to buy a pair of insoles. Now, if you put in a pair of insoles in shoes that are worn out and either the inside or the outside, what may happen is that you may not actually benefit properly from the insoles. Okay, so if you have worn out shoes and you're getting insoles, it is advisable that you put aside those worn out shoes, get a new pair of shoes in which to start using the insoles. And also there is cycling between physical activities. So let's say your typical activity is running and you have plantar fasciitis. We're not trying to discourage anyone from stopping their physical activity, but you may want to cycle between long distance running, or you're running, and maybe some swimming, or maybe some stationary biking. Okay, you need to give the plantar fascia a bit of a rest while you're trying to treat plantar fasciitis. Applying ice, for example, if after a long run, you may want to apply some ice under your foot to keep the inflammation down a bit. It's more of a pain control method. Again, after a run, or before a run, or before your physical activity, or during your physical activity, you want to stretch your calves, stretch the arches, and again, to incorporating the plantar fasciitis strap, let's say in your work shoes, to help support the plantar fascia. And again, to the nice splint, you want to wear that 3 to 5 nights in a row to really start seeing some results with plantar fasciitis. Okay, so that concludes the live broadcast on plantar fasciitis. If you want to come and see us, we are available in Chin Chin Road and Kunopia. That's our number there. You can call or WhatsApp us at 747-5297. And our clinic is going to try to really put out more and more useful content out there for our viewers. Okay, so this is Dr. Sinanan signing off. Really hope you enjoyed that. Thanks.